Okay, we are live now.
சரிங்க. கரெக்டாக நம்ம 11 ஆன் டைம் ஆரம்பிச்சிடலாம். நம்ம தொடங்கிடலாம். ரைட்.
வணக்கம்.
வணக்கம்.
Great. Let's start now. வணக்கம். வணக்கம் டாக்டர். Hi everyone. Thanks for joining this morning. Very good morning, good afternoon, and good evening wherever you are. My name is Vail Raj. On behalf of Marabukudil, I'm extremely pleased to welcome all of you in this session on preventing and reversing cardiovascular diseases. We all know the importance of this topic, and it cannot be timelier with so many tragic losses we all have witnessed in the past few weeks. This will be an interactive session, so please have your questions ready, and you can ask when we start the Q&A session in about 30 minutes. You can also submit your questions in the chat window in Zoom, or if you're on YouTube, if you're watching on YouTube, you can put your questions on the comment section. Our volunteers are watching it, and they can pass the questions on to Doctor. And today we have a unique coming together of a spiritual organization that is grounded in scientific processes, and a scientific organization that focuses on holistic health through lifestyle practices. I would like to first call upon the founder of Marabukudil, Siddha Yogi Rajababu Ayya, to say a few words about Marabukudil. Ayya, over to you.
Thank you, Vail. Thank you, Doctor. That's all welcome. Marabukudil is a non-profit organization founded with the vision to promote and facilitate the holistic, physical, mental, and spiritual well-being of the people by adopting scientific practices from ancient Tamil Siddha literatures. These Siddha spiritual science practices show the spiritual path without denying worldly, social, familial responsibilities. So we have hundreds of practitioners across the globe following the Siddha spiritual practices and experiencing an exciting spiritual journey with improved health and lifestyle.
Thank you. Thank you, Ayya. That was a very succinct and very nice introduction to Marabukudil. And today, Marabukudil is joining hands with highlifejourney.org, a non-profit online initiative that is taking prevention of cardiovascular diseases to a number of patients globally. Sorry for the interruption. Okay. And we have Dr. Anand today. Dr. Anand is founder of highlifejourney.org. And he's here today to talk to us about the cardiovascular diseases and the initiatives that he has taken to prevent or reverse them. Dr. Anand is a professor of medicine at the University of Missouri since 2006. He has pioneered a unique, heartful living cardiac wellness program, both in the US and in India, for improving health. He's been working with many medical service providers, doctors, patients globally, and on this topic, and he focuses on artificial intelligence-enabled therapeutics for global shift towards the paradigm of reversing heart failures. Yeah, hearty welcome to you, Dr. Anand. We are all ears for you now. You can start.
Thanks so much, Mr. Vailraj, and
Raja, for giving this chance for me to connect with Marabukudil and present some of the challenges that we face as cardiologists in overcoming, controlling, and even managing heart patients. Today, I have some slides to share, and after that, we can open it up for discussion. Are you able to see the slide full screen?
Yes.
So the discussion today is about reversing and preventing cardiovascular disease. When we started out, our ancestors, all our ancestors, evolved because of the need for food, shelter, and to survive against natural elements and predators. And this required all of us to be agile, running, walking, averaging 10 miles every day. This is what kept our forefathers alive. And in this evolution that took several million years, in the last, I would say, less than 100 years, things have changed dramatically in all senses of the word. And unfortunately, it has left us here. We are much busier than ever doing desk jobs. SAD stands for Standard American Diet. It is not American anymore. The entire world is lining up in front of fast food restaurants, and the world wants to adopt more meat as it becomes affluent, including India. And people are work-related, becoming more and more sedentary, and increasing social loneliness, and numerous other challenges, but these are the main things that our current generations are facing. When I go back and look at how our story began from ancient prehistoric human beings, the average life expectancy over the last several thousands of years has been between 20 and maybe 40 years. Only in the last 150 years in the United States, we have seen a doubling of the life expectancy. In India, it is now significantly increased and continuing to increase. And throughout the globe, we are seeing increasing life expectancy. The challenge has been in the pandemic, but other than that, if you look at the last 100 years trend, humans are living longer than ever before. There are some blue zones all over the world where people continue to, over several thousand years, live longer than average societies. And what makes these blue zones special? What type of diet, what type of lifestyle they are living? We know from Indian tradition, Siddhas, yogis, they've lived 100 years comfortably, much more than that. So how and what was the secret of their longevity and health? So these are the blue zones that have been well recognized and now published, and they are spread all over the world, including California, Seventh-day Adventists. This is an island in Costa Rica, Italy, Greece, Japan. So culturally they are different, spread out, but people are living ancient, primitive ways of life in most of these places, but they are very connected with their families and they are physically active throughout life. So that makes them healthy, vibrant, and survive close to 100 years on average as society itself in these locations. And if we look at lifestyle medicine, these are the 6 pillars: eating right food, physical activity, avoiding unhealthy habits like cigarette and alcohol and recreational drugs, stress reduction, having adequate sleep, and connecting with family and society. So these are the 6 pillars based on which lifestyle medicine parallels these blue zones that we talked about. So this we feel is a comprehensive way of giving holistic longevity to our society's health. This is what the American Heart Association talks about. Simple 6, 7, and now 8 steps that we all recognize. We should not smoke. We should get 7 to 8 hours of sleep, eat mostly plant-based food, which is fruits and vegetables, rather than excessive meat consumption, some minutes of exercise, roughly about 20-30 minutes every day of some exercise, and keeping an eye on the blood sugar, blood pressure, cholesterol, and weight. So these are the basic ways of taking care of our health. But what we also have to recognize is that no matter how much emphasis we place on advanced technologies, latest balloon stents, medicines, and cardiology, healthcare itself altogether contributes only to 10%. About a third is contributed by our genes. More than that is contributed by our mindset and behavioral choices. Social circumstances is important, and environmental toxins contribute. So at the end of the day, everything a cardiologist can tell you will only give you 10% success. 90% of an individual person's health is outside the scope of a healthcare provider. A lot of it is in your own hands. So that is what I want you to recognize when you interact with your doctors. What is the role of mental stress? Likely 30 to 50%. Genes, probably about 20 to 30% at the end of all the latest evidence that we have. So this is a very different approach. Instead of looking at diabetes or heart attack or heart failure or stroke, we are looking at the genetics of aging. So when we do that, instead of looking at chronological age, which is our birth certificate and passport, we can look at biological age, which means how much time we have left. Okay, so this is based on numerous factors. It's a busy slide, but anything in red means it is accelerating our biology's aging. That is, our genes, our body is getting older faster than it should. And that ends up being having excess weight in our body, diabetes, kidney failure, immune problems, infections, and being men, that itself is a risk factor. Women, especially if they are premenopausal, you see the green, which means it's protective. Women have age lesser than men, before menopause at least. And then parental longevity. That means if you have parents and grandparents who are 100 years of age, that means you inherited lucky genes, and you will probably not have any heart attack, stroke, or even cancer into your 90s and 100 years of age. But unfortunately, most of us don't inherit such blessed genes. So if there is, on the opposite end, family history of early heart attack in their 40s or 50s, that means we are also at high risk for heart attack, even a decade earlier than our parents' generation sometimes. So chronic mental stress plays a role. Socioeconomic status itself plays a role. So if we are affluent, then we have less risk of heart disease. And then comes the food intake, high salt intake, refined sugars, smoking, alcohol, drug abuse. And then physical activity is a useful thing, and adequate sleep, high fruit and vegetable consumption, nuts, seeds, legumes, which is highly prevalent in our Indian diet. Moderate alcohol consumption, they are saying is okay, but if you see the next iteration, my suspicion is zero alcohol is going to be the best for biological DNA epi-age. This is a very interesting study that was reported only recently, looking at a group of healthy, normal weight monkeys eating normal diet, which you see on the left side. But on the right side, another group of monkeys, again same age, normal diet, normal size, they took a food cut of 30%. After 2 to 3 years, what is happening is normal monkeys normally age on the left side, whereas the monkey that is getting less food, otherwise everything else is same, is not aging. So this study is not true only for monkeys, which are our closest relatives. They have 97% genetic similarity with us. Only 3% of our gene separates us from these monkeys. If you look at other mammals, other relatives of us, including fish and microorganisms like bacteria, all animal species, if we cut down food supply, they seem to live 20%, 50%, some species even 100% longer than their age that is predicted by nature. So how come calorie restriction makes animals live longer? So the specific mechanisms, we can spend hours together on it. There are numerous studies over the last 60 years. But then we have now done finally some studies in human beings and shown very, very similar results. In 35-year-old human beings, if they take a 25% calorie restriction for 2 years, their biology reverses about 5 years roughly. That is what we are seeing in humans also. These types of studies are extraordinarily expensive. So after 2 years, we don't have any further follow-up. Okay. I'm going back to the migration of humans that took place over several thousands of years. And that's how from Africa we are supposed to have migrated to different parts of the world as human beings. And these are ancient civilizations that we recognize world over. And then here I'm showing you the traditional systems of medicine that have been practiced in all parts of the world. And in India, I really sense that we have the most rich tradition of ancient medicines. And in this picture, you see all the lineage over few hundred, few thousand years. When you go back, you see Ayurvedic medicine, Chinese and Egyptian. Siddha does not even figure because people have forgotten it because of foreign rule and so many other reasons. But I really think based on our own tradition and research and everything that we have found that our Siddha tradition probably dates back even before these Egyptian and Ayurvedic systems have been there. That's why I added it to this picture and presented this at Academy of Integrative Health and Medicine this year. So if you go back 5,000 years, what is the evidence that human beings existed? This is the oldest monument of human civilization, and they are not called pyramids. They are called Great Pyramids of Egypt because they are so massive. And luckily, the whole world did not adopt a lifestyle like this. This is just a tomb. People thought that by building such huge tombs, they can have a safe journey into the afterlife by building such huge tombstones. So if every human being did this in the last 5,000 years, this entire world will be filled with tombstones like this, and there won't be space for any more humans to live. Instead, our Tamil culture has taught self-inquiry. Why do I say Zen? Because a lot of Buddhist tradition that is practiced as Zen, if you look at the literature, dates it to Bodhidharma, and his tradition comes from our Siddha philosophy. So that is why, despite so many hundreds of years of rule by foreigners in our part of India, I really believe some of our traditions are still lingering in other parts of the world beautifully. If you look at 8 stages of yoga and the Tamil version of it, it is so beautiful. I don't have to go into all these details because you are learning it through Marabukudil. But this is what I've been using in cardiac rehabilitation for patients dealing with heart attack, heart failure. The power of meditation, art, yoga, ogam, and martial arts like Adimurai, which is now still prevalent as Kung Fu in China. You might ask, doctor, how can you teach dance or Kung Fu to your heart patients? The answer is, if I treat only with medicines and balloons and stents, I'm only treating the surface problem. I want to go deeper and change the lifestyle so that we can prevent the next heart attack. If we go deeper into the psychology, intuitive lifestyle, then lifestyle and medication, all these become so much more natural, intuitive, and sustainable transformation. Then when we connect at the being level, at the meaning and purpose of life level, then the person really transforms as a whole. So that is where I really believe we can bring a societal transformation when we work with our communities. So as a cardiologist, acute myocardial infarction and acute decompensated heart failure takes all my time. There, practicing modern medicine, I can improve lifespan. That is all I can do. But if I work with the Siddha wisdom traditions, I'm able to holistic impact on health span. And then when we connect with the Siddha tradition that gave us Bharatanatyam and Kung Fu and Adimurai and so many sports, then we can capture creativity. The challenge with these things, mind-body methods, are they have to be adopted at a young age, starting 5, 10 years of age. They need 10, 15 years of training to become good at. That's why these are not suitable for my heart patients. But mindfulness meditation that can even work towards higher consciousness. So we work on these aspects of Siddha, self-inquiry. Yoga is practiced in the Western system more like exercise, but our tradition, if we are able to embrace it the right way, we can capture many of these levels. And this is what I've been doing now close to 10 years, self-inquiry. And we use the Siddha principles for it. And what we see is even at the age of 70 or even 80 years of age, heart patients are able to get better in the hospital, improve their lifespan, health span, learn new things. We have an 80-year-old you're going to meet today who's now signed up for a dance class for the first time. After 22 years of struggling with heart failure and trouble breathing, walking from one room to the next room in her home, she's learned this in 6 months and transformed her life. So this higher consciousness, again, we are starting to publish our results with our methods in evidence-based journals. Elevating consciousness is my real interest. We've been working in this area for, I would say, 7 years, saying that self-inquiry, turning our attention inwards, asking the simple questions, what is life about? Who am I at the core? So this is what we teach here at the university, and we've made all this material available for anyone interested anytime to view online. So when we look at the pills and procedures that we have for heart problems, it looks unsurmountable, such a huge weight. 30 pills, 6 doctor's visits, 4 procedures, having lost a dear one. Within 2 months, a 70-year-old cannot cope with all these problems. But when we elevate consciousness through self-inquiry, all of this changes. Everything looks manageable when we wake up the inner nature. So this is what we use. The Mihai Csikszentmihalyi, he just died this year. He brought about this concept of flow. And what that flow means is facing the life's challenges with our optimal skills. So this he described with playing tennis. So if somebody is not trained in tennis and I was to play and I love to play tennis, I'll be bored. But if somebody is very good, say like Roger Federer, and I end up playing with him, I'll be too self-conscious and nervous to even step on the same tennis court that I've played for the last 30 years because I'm playing with a world champion. So I'll be worried and anxious. But if I was to play with another person my age and somewhat average skill like I am, then there is a chance when I give my full effort with a person my level of challenge that I can enter into flow. Then you may ask, doctor, how are you using this flow for your heart patients? This is so easy to use once we connect with our Siddha fasting and meditation methods. So that's what I've been using. And we use it to overcome not only heart problems, post-traumatic stress, disorder, anxiety, depression, so many other mental health issues. Along with heart problems, we are using our mindful self-inquiry practices to the point that we don't stop at flow. I believe our Siddha tradition went well beyond all this. So the flow that we talk about is only the beginning. We can go all the way to higher consciousness, what is known in the literature as samadhi, enlightenment, bliss, just using our hunger and gratitude principles. We have several other pillars for the high life that we teach, but just with hunger and gratitude, we have so many heart patients reaching this level. And then we have a few that we have just published, the references here, saying that we can go to an even higher level, which we call uvagai. The word uvagai in Tamil means extreme happiness without a reason. So we don't need a basis to be really happy. That is a heritage that we have for several thousand years from our Tamil culture. So when you look at life with that level of positive psychology, then all the challenges, mental health, cardiac health, all these things become much easier to cope with. So this we have taken to Academy of Integrative Health and Medicine this year as a formal course, the higher consciousness self-inquiry towards PTSD and depression, so that doctors can learn this and practice And we've made this available at highlifejourney.org. Anyone can access it like Khan Academy. Over the last 3 years since the pandemic started, we've been able to capture most of our meetings, including today's meeting. If I have access, I'll place this also in the website. So anybody in the future can view it at their own free time. The Seeking Hunger book is not available in some countries, but it's on Amazon, and it's meant to teach in 30 pages how we connect with food intuitively. That's all it is. Very simple reading for basis of understanding self-inquiry. So what we are now saying in 2022 is this heavy truck can transform into this race car. How we do it takes me 8 hours. So I invite you to view the videos in our website, highlifejourney.org. But what I'm trying to show you here is heart patients who are not only preventing progression, who are actually reversing their heart problem to the point that they are building the confidence of a race car. I'm going to show you some examples. This is an 80-year-old Marilyn Lake who went on TV. The link is here. If you click it, you can view her 10-minute TV interview with me. And what she is saying is, after being in our program of Siddha consciousness, which she started in March, when her weight was 107 kilograms, she has now lost 22% of her entire weight only by smiling. That is the beauty of our method. And her age is not 80 anymore. Biologically, her age is 60 because her weight is down. And activity-wise, walking from one room to another, she would get out of breath. Now she's walking half a mile without getting short of breath. So she's had heart failure for 22 years, and that's now cured. So this is the first evidence that heart failure can be cured. And I'm so proud to present this with our Siddha consciousness group and tell you that I've also worked at this from a positive psychology perspective and found the benefits are mind-blowing. So this is our first example. And then this is another example. What I'm showing you here is a person's weight in the y-axis and time. So within January of 2022 until current date, this is all medical records. You're seeing her weight is coming down. And this patient's weight was 240 kilograms. So he felt like a 60-year-old. Now he's feeling like a 20-year-old. And his heart function, which was extremely weak, has now normalized because his weight is down by more than 50%. And I didn't even meet him yet. So he did this course online without directly interacting with me. This is not a patient. This is my colleague. He's the chief of heart surgery, Dr. Markley. And after losing 43% of his entire weight within a year, he's now feeling like a 20-year-old, fitting into 20-year-old shirt that he got and walking, running, weight training, really doing all his surgeries with so much more energy. So I'm showing you success stories of our ways of intuitive healing. So this is the summary I want to leave you with. The risk for the heart starts very early throughout the world. For men, more than 40 inches waist circumference, for women, 35. But unfortunately, people in Southeast Asia, India, Pakistan, Sri Lanka, waist circumference more than 35 puts us at risk. So at 5 inches lesser. For women, 4 inches lesser. At 31, we have to be careful. We have to target a body fat percentage. If you have it in the gym or your doctor can measure it for you, we want men to get below 20% of their body to be fat. For women is a little higher. Up to 30% is acceptable. But by and large, BMI still is below 23 for both men and women, ideal range for people of Indian origin. So to summarize, our High Life teaches intuitive lifestyle to sustainably not only prevent but also reverse people with heart failure and heart attack. And our principles are based on mindfulness, anti-inflammatory diet. We teach what we call hunger, gratitude, meditative fasting, the flow exercise. There's numerous exercises we teach, and we don't teach, we inspire people to do it on their own. We just teach the methodology to approach it right and connecting meaningfully with their own community and their family. So this is the core reasons that we believe we are seeing so much success, not only in increasing longevity, but I would think so much more important is improving their healthy quality of life years, reducing their comorbidities and giving them ability to be free of these medicines and procedures and pain and do things that they want to do with their life throughout. So I want to stop here saying that only 2 days ago, we opened this for veteran administration system throughout the country. So now the High Life program is available nationally for any veteran to access and help their heart failure improve. So if anyone is interested, you don't have to be a veteran. Anybody, anywhere in the world viewing this, if you reach out to us, this is our email, the phone number. We will be happy to give you the material, give you the training, empower you to practice this way of life. So I will stop here and glad to take your questions.
Great. Thanks. Thanks a lot, Doctor. That was a great presentation. In 25 minutes, you really packed so much information. I only wish, we had much more time with you, but we, totally appreciate, you're taking time to be with us. It was great information. It's heartening to see that, you're taking our ancient wisdom to the Western science. You're applying the scientific methods and proving that these are really working. Thank you, Doctor. And you throughout your presentation, we could see that, you have shattered so many myths. Alcohol consumption, people used to think a little bit of red wine is really good for health and all of that. You're saying, zero alcohol. And in fact, about the food, in Tamil, we always believed unave marundu, food is the medicine. And in fact, Tirukkural had a whole chapter on, food and eating habits. But Western science, I think in the past, I've always heard that food has nothing to do with your health. But you are shattering that myth, and you're really, taking our ancient practices and proving to the world that they work. And thanks for those excellent examples. We have, hundreds of participants here, and we have questions coming up. I'll probably pick up some questions and read so you can answer that.
Very important discussion you brought up about food. Next month, I'm in Chennai for the Cardiology Society of India, our 74th national meeting. And I'm presenting several of our papers there and chairing so many sessions. But the key message I have is that cardiologists have to connect with all the other healthcare providers, including endocrinologists, primary doctors, others, to emphasize the importance of not only the physical weight, but the mindset. Because we can say, oh, everybody should look like a Miss Universe, but it's easier said than done, especially as India is becoming more affluent. Affluence means people go out and eat more, and eating more involves, unfortunately, eating more meat. And that is what is getting the Western societies into more health trouble. In the US, they are spending 20% of the entire GDP on healthcare. India is spending 2 to 3%. So what about all the health needs? We are not meeting it. People are losing health, losing lives. So if we recognize the basic value of how we can help our health by eating the right amount, exercising, very, very little exercise actually, but eating right becomes, I would say, so important. Thanks so much for bringing that point up.
Thank you. Thank you. It was a very interesting research that you showed with the monkeys. The monkey that was fed less was more healthy.
This research takes so many millions of dollars. And then humans also, we have done that research, and I'm happy to share that. Atrada arindu kadaipidithu tuikat, I forget it. Tuikat tuvara pasit. That is how it ends. Valluvar says,
really
so figure out what your body really likes, tolerates based on how you feel after you eat. And then eat only when you're really, really hungry. Valluvar said this 2000 years ago so beautifully. So we need to connect with ourselves. Then we can go to the nutritionist, dietitian, medical doctor, cardiologist. First, we need that connection. That itself will give us so much health. Thanks so much for bringing it up.
True. The usage of that word, Tuvarapasitha, is like your stomach has to be dry, right? Tuvara means dry. It has to be really dry, and You should be hungry. Yeah. Thank you, doctor. And we'll move on to the Q&A. And to those who didn't get a chance to submit your questions on the Google form, you still have chance to put your questions in the chat window here. Or if you're on YouTube, please put your questions in the comment section. Our volunteers are watching it and they'll pass the questions on to the doctor, right? Thank you. The first question, doctor, we have is from Kavin. The question is, for people who fast for a week, once or twice in a quarter, year, or what he means is like, inconsistently or randomly, if people are fasting, what advice would you give to keep them healthy?
So in our high life system, what we are requesting people to do is to about 14 hours every night not to eat anything. So if you finish your dinner at 7 p.m. until 9 a.m., don't put any food in your body. If you have to leave work in the morning at 7 a.m., try to finish your dinner at 6 or 5 p.m. if possible. For 14 hours every night gives us a lot of chance to heal. Once a week, 24 hours is excellent. So people who are not pregnant, who are not diabetic on insulin, who don't have advanced liver disease, and that's all it is. These are the biggest challenges, and those who have eating disorders. So other than that, which means nearly 97, 98% of the world, we can go without food for 24 hours once a week. Our body will be thanking us for it. For me, 45 years, I did not realize this, but in the last 3-4 years, I've been doing it, and I feel so much more energetic personally. So this is what, 14 hours every time, and then 24 hours once a week. And then there are so many religious systems throughout the world where people go for 5, 7, 9 days fasting. So I'm not going to suggest that or recommend that. But if you look at reducing cancer risk by autophagy, specifically, there is some family history of cancer for you. My suggestion might be to, instead of 24, try to go to 36 hours maximum. Beyond 36 hours, there might not be that much medical benefit. As a physician, I'm not going to ask anybody to go beyond 36 hours. Okay. Right. If you ask me if is it harmful, very likely no, until several days. But I don't have the evidence to say one way or the other. We have heart patients who have fasted 50 days. We published that also. But we don't want to confuse the message. Message is once a week or once in 2 weeks, 24 to 36 hours is good.
Right. Okay. And also you said the daily, intermittent fasting, that is 14 hours.
And the word intermittent fasting is not a good word. The reason is the rest of the time we can party like that people think. Mm-hmm. Life means this is a spiritual gathering also. It is not just a medical meeting because of Marabu Kudil. So I'm going to request you to consider what I'm going to say now. What I've done since 2018 summer is made a self-inquiry, or my question to myself is, how little food do I need to do everything I have to do? I have to come to work. I have to take care of my children. I'm allowed to play tennis, 2 hours of singles tennis. I play on several days of the week. So I haven't given up any of that. We have a new puppy. So he has too much energy. I have to take him around. So all that I do. And for that, I'm every day figuring out how little food I need. And the answer is, in the last 4 years, I've averaged about 50 to 60% of what I used to eat for the first 45 years. And I've not lost any weight. So this fear of losing muscle, losing bone weight, nothing happens. If our intention is correct and we are moving in the right path, this itself becomes meditation. We don't have to learn more formal meditative techniques. Just basic, this much has been taught for us for several thousand years. We don't need another 100 studies by the NIH and publications in Science and New England Journal, medical journals to prove to us that simple intuitive living is good. This we can take up, and we'll be so much better off for trying it.
Thanks a lot, Doctor. Thank you. The next question is from Mr. Chandramohan from Fairfax. The question is, in spite of clean diet and fitness regimen, South Asian men are having heart issues and pass away before their time. Medical industry doesn't want to prescribe screening tests for people with clean blood work and healthy weights. So the question here is, what kind of cardiac screening tests will make us sure of where we stand? What is the best way to have our primary cardiologists prescribe the necessary tests?
So I'm assuming this question is from the US. Yeah. And the answer is, it's very challenging. If you have some symptoms, talk to your doctor, that might qualify. Angina means chest pain. So without angina, sometimes having trouble breathing or palpitation or extreme fatigue, these may qualify as anginal equivalents. And you have to tell your doctor that you're concerned you may be having a risk for heart attack and your family history is high, because even the Western doctors may not be aware of the burden that we Indians unfortunately carry. What happens in the US in the 60s, maybe in the 50s, in India, it happens in the 20s and 30s. That risk does not change just because people have relocated to the US. In fact, that risk may be even more. Why people of Indian origin unfortunately have heart attack in the 20s and 30s, we don't have clear answers yet. The lipid profile we check lipoprotein little a, homocysteine, some other markers, high sensitivity, C-reactive protein, things like that. But the true answers are not available. One thing that we have started to recalibrate is, for the Western world, we say BMI of 25 is obesity, is overweight. But for Indians, we are saying BMI of 25 is obesity itself. So 23 or below is what we are shooting for. That's why I showed one slide. So really focus on eating the right food and moving towards the ideal body weight. If you look at highest performance tennis players or long distance bicyclists who go to Tour de France, their BMI is 21.7 to 22.2. It's so narrow range for 200 people biking. So it's not by chance. It's just that to be so efficient, they need to do that. And if you see most of the people in the blue zones, that's how they are. They don't have any extra weight in their body. They say they have an 80-20 rule. 80% of their stomach they eat. But the reality is they want to eat just as much so that they have to be up and around. They don't have time to nap, or they cannot go to a computer. They have to physically work after that meal. And they realize there's only so much you can eat to be able to be physically functional. So that is the real crux that we have to connect. But talk to your doctors, tell them that I come from India, there is a family history, I'm concerned. So that itself will trigger some sort of testing. Another thing that some of my friends have done is, whenever they visit India, it's very inexpensive to get for a person flying to India for 5,000 rupees, 10,000 rupees, they can get some good quality testing done. So what tests to be done? If there is family history, you are above the age of 35, 40, and you have family at the age of 35, 40 with heart disease, best thing may be a coronary CT angiogram, because it is non-invasive. There is some very, very, very small risk of radiation or kidney injury, but it gives you a clear, definitive answer. If that is completely normal for the next 10, 15 years, you're okay. But throughout life, even if the coronary CT angiogram or the true invasive angiogram is normal, next day we can have a heart attack. That risk is still there. We are not like a car that comes with 5-year, 50,000 mile warranty. We are human beings where one negative thought, the question that we have, one quarrel with our loved one or a fight with our boss in the job, something that night can trigger a plaque rupture and a heart attack that we may not wake up from the next morning. So I'm not saying don't worry about anything. We all have to become Siddhas, but it's not possible. We are living in the real world. That's what the introduction was. Even Marabu Kudil doesn't want everybody to give up living in the society. But living in the society should not mean we overstress ourselves. We have to build that resilience. That mindfulness, self-inquiry, meditation, all these things give us the opportunity to learn a little better every time. So I hope I answered. There are some blood tests. CT angiogram may be the best. At least a treadmill should be done. If it's not done by your health insurance, it's a concern. Anybody above the age of 35 definitely should have that consideration. That's what it looks like. I've moved to the point of saying all of us above the age of 30, 40, who are of Indian origin, is a bonus. When we look at life like that, then it reduces the stress. Otherwise, we have to go home wondering when is that time bomb going to go off. We don't want to worry too much also.
Exactly. Yeah. Reducing stress is a key thing.
Yes, it is a very important thing.
Yeah. Doctor, the next question is from Karthik from Texas. How people with less or reduced mobility can maintain a healthy heart?
This is what I spent 10 years on, because I work in the VA system. We wanted to reverse heart failure and heart problems, but we found veterans have too many disabilities and mobility issues. And we have a lot of home-based programs. Some people with leg issues or back issues, they can exercise with a bicycle for the arm on the dining table. It's called arm cycling. It's like 4,000. I mean, it's $100. It's available in the stores. You can increase the resistance and work with your upper extremity. It's called a transference phenomenon. That same benefit will go to your entire body, including your heart and your lungs. Upper extremity weights can be done. A lot of little things can be done. But exercise itself, if you go deeper and deeper and do the research, is not that essential. The mind is so important. And again, I come back to moving to your ideal weight. You may say, Doc, if I cannot exercise, how can I lose weight? The answer comes back to eating right. Coming to your ideal body weight does not have anything to do with exercise. Most cardiologists or doctors don't even recognize what I'm saying, but that is the truth. All of us can achieve ideal body weight wherever we want to be by adjusting our food intake.
Okay. So here's another follow-up question also. What is the reason for high BP even after reducing or controlling the contributing factors like stress and salt?
This is a very, very important issue. Faced by heart attack, at least is 10-20%. Hypertension is the most prevalent thing in society. 50, 60, 70% of our society has high blood pressure. When you look at the current definitions, we want to reduce blood pressure to below 125, below 85 if possible, because any number above that, the risk starts going significantly. So the first thing about blood pressure is check it. Check your blood pressure at home, at Walmart, or with your doctor. And what we are now recommending is standing blood pressure. Instead of sitting for 5 minutes, just standing up and checking it also has a lot of value, maybe even more valuable than the sitting blood pressure. And then if you look at the reasons for hypertension, 95% of it is called essential hypertension. There's nothing essential about high BP. It is called primary hypertension, where there is no reason. Secondary hypertension means it is due to some problem in the kidney or some problem in the adrenals or renal artery stenosis, some specific thing that we can fix and improve their blood pressure. So most people, 95% at least, if not 98, majority, all people with hypertension for practical purposes have what we call essential or primary hypertension. But now, in the last 5 years, what we are seeing, once we practice this type of intuitive or integrative cardiology, what I'm sensing is many of them will get so much benefit by learning mindfulness, relaxation, meditation, higher consciousness. All these are so effective because the stress levels in the body go down sustainably when you learn mindfulness practice. And then with weight reduction, 70% of the blood pressure comes down. So practice again the same things that we discussed. Your blood pressure will be better, and check your standing blood pressures. And there are so many medicines in this day and age that nobody should deal with high blood pressure. It just needs to be measured and controlled. If doctors will do what they can, and integrative systems, yoga and mindfulness have so much value. And food-wise, cutting down dramatically on fast food, salty food, and meat consumption. That will really help bring your blood pressure down.
Okay. Thank you, Doctor. I think those are some good words of advice. And we have the next question from Siva.
Before we go into the next question, so I would like to invite Dr. Chockalingam, who is actually pioneer in setting up Tamil chairs across the world. I want to, have him a few words to share. What is the importance of having Tamil chair, so that all this, the research is going to be helping the global community in terms of the wellness. So thank you, Dr. Chockalingam.
Welcome. So nice that you could join us, sir.
Of course, Anand, I won't miss it. Anand, congratulations. I don't think I have any questions, but I think you have brought to the forefront what everybody knew or thinking about, mulling about. And talking about fasting is not fancy when I moved to this country at 75. But of course, நம்ம ஊர்ல விரதம்னு சொல்லிட்டு they were eat, especially women. And there were also so many reasons. In my practice, all I used to say is eat less, walk more. These are the two words. And it was so popular in my town. I got it after the beer commercial, less filling, great taste. So I thought this is what I used to write, eat less, walk more. And not only that, as I was pointed out, மாறுபாடு இல்லாத உண்டி மறுத்து உண்ணின் ஊறுபாடு இல்லை உயிர்க்கு. So it's not just to eat because you see good food, taste good. I used to tell my patients as a cardiologist, you don't need, your car is full tank of gas, but because it's free the next door, you don't fill up the gas. That's what we are doing because the food is tasty and free. And don't eat because I used to tell the nurses, they used to understand. And when you said about the heart attack, I also used to tell, it's not like any other organ. Look at the light bulb you're sitting under in the hospital. Hey, doc, how did I do the test? Am I going to live longer? I don't know that. All I could tell you is just like a light bulb, it could go anytime. But then what the hell are you doing, doc? I used to tell them, you have signed a lease with your Lord, whoever you believe. I'm just like a building supervisor. When the water doesn't run, I check the plumbing or change the bulb. That's about it. So it's just a practical approach more than all the stents and intervention we could help. So you have brought to the public, especially for our Indian community where we have a more heart disease. I don't know whether you are aware, Anand, but other public may not know that South Indian population has a 4.5 times heart disease than the white population. That was proved by atherosclerotic autopsies done by one guy by name Dharmaraja in Singapore in 1920s. And coronary artery disease in Indians is 4.5 times more than the whites. We are not used to all those fancy affluent foods. So in short, you eat what you want, but you eat as little as you can. That's the comment I will. So with eat less, walk more, I don't think any questions. Congratulations again. You are making a very good impact in the society compared to what we have done, putting stents and stuff. And வாழ்த்துக்கள். அது அரேஞ்ச் பண்ண உங்களுக்கும் மிக மிக நன்றி.
நன்றி ஐயா.
Thank you.
Yeah, back to Will.
Oh, thanks. Yeah. So I think the next question is from Siva from Maryland. This is, I don't know if this needs an answer, but yeah, I'll read the question. I was taking statin as told, but it was hurting bones pretty bad. Later, I started soaked fenugreek and it brought down cholesterol with much less statin. So that's something of a personal experience. And if you have any thoughts on that, Doctor, if you would like to say.
Yes, a lot of people have muscle aches with statins. So it's a challenge. And we have PCSK9 inhibitors and other medicines which can bring it down. LDL, bad cholesterol, we want it below 70 mg/% if you already have a heart attack or diabetes. So that is what we are trying to achieve. But again, most of these studies in the last 30 years have been done in other populations, not in our Indian populations. And whenever I come across Indians, I'm surprised when they tolerate a statin. Many of them cannot. At that level that they are recommending for the Western population. So we do the best we can. And again, it comes back to eating right amount and lesser amounts.
Sure, doctor. And the next question is also about personal health. I'm skipping the name, but the question is, I discovered I have 4 blocks and thickening valves in heart. Mitral valve is failing. Can I get advice for the next steps? I don't know if it's the forum, but
Sure. Very quickly, we can say that the mitral valve is something that is connected very closely to the left ventricle. So if the heart is weak from the blockages, there's a chance that valve is also a problem. So when you get the coronaries fixed with a bypass surgery or with stents, good chance that valve problem may disappear. But then we have to look at that valve closer and make sure that either at that time or even in the next 6 months to 1 year, it's not getting any worse, then we can address that. Surgery has to be done, or stenting has to be done if the patient has some symptoms or heart squeeze is weaker. Ejection fraction should be 55% normally. If it's dropping and if the patient's having chest pain, better to get it fixed. And then you can still do the lifestyle so that future problems we can avoid.
Thank you. Yeah.
I think I'll skip over to some questions in the Zoom, actually. We have a question from Sampath. we usually take timely food like 3 times to how our body adapts to it. If I want to reduce weight, should I reduce my intake by going on fasting? And how fasting helps and how our body accepts this. For example, if I miss one meal, I feel a bit tired. And is it my mindset? Or I think he has answered that himself. Or
No,
body
it's not
feel
mindset. The body really is used to certain amount of food. Until the age of 45 for me, until 2018, I have not missed a single meal. Every day, 45 years, I had 3 meals, thinking that's the only way a human being can live. Nobody taught me any differently. I went to medical school, became cardiologist. There, I didn't learn anything differently. But then when I started looking at food as a way of self-inquiry, of being meditative, then automatically it dropped so much. But even then, when I'm doing it out of gratitude, when I'm doing it out of my happiness, even then it is hard. I have a headache, feel as if there's an earthquake, the earth is shaking. For 2-3 months, I had that challenge. I'll feel irritable, little more angry. But then after 2 months, 2.5 months, it disappeared. But the key thing now I will tell you is try it for at least 6 months when you become friends with being hungry. The way to become friends with hunger is by drinking plenty of water, and keeping the mind in a very positive state. So we teach, that's why we call the hunger and gratitude. Continuous fasting. So since 2018 till today, I'm in fast. I'm going to continue fasting till I die. There is no reason for me to ever fill my stomach. So even if I eat whatever I can, I'm still hungry. That's because over the last 4 years, I've taken down the food intake by so much that being hungry is such a blessing. That means I'm more alive. That's all I'm sensing. And when you're meditative like that, whatever BMI, weight, body fat percentage you want, you will reach. I did not know this, but my lipoprotein little a just before was checked. It happened to be because that was my annual check. That's some number that doesn't change. That's what science says. For me, it dropped from 27 to 17 within 1 year of cutting down my food intake. So I never looked very big or anything. So even normal looking people, there is so much more extra health we can gain by smiling and putting whatever is the really needed amount of food. Like Dr. Janagaraman beautifully says, eat right, eat less, and walk more. But it's easier said than done for many people. But try it. You'll be fine if you're not diabetic and other things. But it may take some weeks, some months. Just slowly work with your body, encourage it. It's learning these things. And I learned it at 45. I have patients. You met somebody, Marilyn Lake. She learned it at the age of 80. And she's such an inspiration. She's now feeling like 60. So that message is that straightforward. By eating lesser, she has turned the clock back by 20 years. And we want to publish it and tell the cardiology community that heart failure is not a written in stone. See, at the age of 20 or 30, high blood pressure, diabetes. 40 or 50, heart attack. 60 or 70 is when heart failure happens. But at 80, if somebody is able to reverse 20 years, and in 1 year, next year she may reverse it another 10 years. I don't know what she's going to do next year. But when we connect with our inner nature, magic can happen. But do it in a reasonable way with your confidence. The simple clue I give is 20 smiles every hour. As children, we all smiled 40 times every hour. As adults, it's down to 1, maybe. So it's a 20 times increase from our adult level. But from our childhood level, it's still only half. So if we are able to smile and then move through our exercise or chores or work or even the fasting which you're doing, there's no time commitment to it. It actually saves you time in the kitchen, cooking and eating and all that. So if you're smiling, then you're okay. Drink plenty of water. That keeps the mind in a positive way. And after a few weeks, few months, your body will acclimatize to it. And then after maybe another 2-3 months, it'll start really thanking you for it in so many ways. You'll feel more energy. You'll feel more connection with the people you knew for last 70 years. You'll really connect with them deeper. This is what my patients are telling me. Yeah. That is the higher consciousness. So that happens intuitively. If you want to elevate consciousness, there's no elevator to climb, right? So it's just connecting deeper with genuine interest in life itself.
We know the secret now, Doctor. In the last, I think about 40 seconds, you were smiling for more than 20 times. So I think all the participants now can take this opportunity and smile once. And when we proceed to the next question, I know I'm conscious of the time also, so I'm going to pick some questions. We
you ask the questions fast, I'll give very brief answers. Sure. How many ever you have, I'll give. I'm Great. Here. I'm not in a rush.
Sure, sir. So the next question, actually, very pertinent one from Hema. recently we hear a lot of people who exercise regularly also having heart attack and cardiac failures. Any tips to
Because
avoid that?
people go to their doctor or cardiologist or exercise therapist, and everybody says you need to exercise more. But if your heart is already in trouble, it might actually be putting you at more risk. So be careful and don't think exercise is going to be the solution. If it is within the 20 miles, then it is okay. Otherwise, figure out what else is not right with you and correct the mind, correct the body, learn meditation. That might be the first thing. But then definitely we need exercise. For me, I'm able to stay energetic because I'm playing 2 hours of singles tennis. Without that, I cannot. There's only so much we can talk. But that shouldn't, everybody cannot just like that say, I'm going to go and weight train or run the marathon. It all has to slowly happen out of our confidence. Build the confidence first, slowly, and then you can go from there.
Sure. The next question from Mahesh Veera. What is the importance of getting a calcium score and what is the normal range for the score?
0 is the normal range for calcium, ideally. But above the age of 50, 60, we see some calcium. If we see more than 900 or 1000, there's a good chance there could be some blockage. But for Indians, 0 calcium itself, we've seen coronary heart attack. So even 0 calcium doesn't mean you won't have heart attack. Okay. So at the end of the day, as a cardiologist, I've never ordered a single calcium score test in my life. But people come to me because they did a score somewhere or what needs to be done further.
Sure, sir.
CT coronary angiogram is different from CT coronary calcium. Calcium score is very easy to get. CT coronary angiogram is a more detailed analysis of all the main arteries. So that is the one I'm recommending, CT coronary angiogram, not the calcium score as a big deal.
Okay, great. And does fasting mean no food at all or light meal is okay?
Water.
What? Okay. That's
little bit tea, coffee is okay.
Okay.
Nothing else.
Sure.
Even that is not needed, but that's okay. People who go for several days, they use lime and honey and little salts they need to replace. But for 24 hours, 36 hours, just some water is good enough.
Okay. So that was a question from Jay, but Anita is having a follow-up question like, will it not create heartburn?
No. It will actually help you heal.
Okay. Okay. If a person already has ulcer or heartburn after fasting,
if you're taking medicines for heartburn, you continue them. Yeah, I'm not asking you to stop the medicine, but it doesn't worsen. We've done this for 10 years, thousands of patients. Nobody has complained of gastritis getting worse.
Okay, great. And Sridhar has a personal question. It's about blockages in LAD and taking some Siddha medicines from Dr. Shivraman. Is able to make 7,000 steps. Initial 2,000 steps have breathing issues, and also when I do physical exercises, do I need to make any changes in the food? Or
I'm not familiar with Siddha medicines. I teach Siddha consciousness based on my understanding of self-inquiry. So for medicines, I would rather have him follow with his own physicians.
Perfect. So there's a question from YouTube. Can you please advise about keto diet? Is it something that can be followed?
Excellent question. I'm glad somebody asked it. My recommendation is very direct. Don't take it. Because it might help your diabetes, make you lose weight. That adds more fear to me. Because that is misleading. Keto diet means 70% fat, 20% protein, both of which are not our natural diet. I showed you where we evolved from, monkeys. We are not like the lion. We are more like the deer. We are more herbivore. We are not carnivore by nature. And our body will heal so much better with a plant-based whole food diet, which is not very similar to the keto diet at all. Carbohydrate does not mean... carbohydrate is now looked at as a bad word. Low carb is what people are talking about. But fruits and all the vegetables, the fruit means you cut with a knife. It's not something you open in a bottle. Fruit is with a knife. It's a real fruit, real vegetables, boiled vegetables. All these are the best things to heal the heart, reduce atherosclerosis, inflammation in the heart. Okay. Ketogenic diet may reduce your diabetes numbers, but all the studies that have been done are a few months or maybe 1 or 2 years at duration. I'm talking about a whole lifespan of 50 or 100, 120 years. For that, to minimize the risk, healthy diet, which is your own grandmother's diet, will be ideal. Whichever culture you come in the world from, our Indian culture, you can get such healthy food. But in the Indian food, avoid sweets, minimize oil, and you'll be in very good shape.
Sure, doctor. And there's a question from Somu. Is the probability of cardio issues low when for someone with low BP?
Low BP means you live 100 years.
Okay.
So it's good.
Another question is
let's I think doctor agreed to stay for a couple of more minutes, so let's announce that we'll be extending the session.
okay. So how long, Raj? How much more time we have?
Let's check with the doctor. Yeah. Sorry, Raja, go ahead.
Yeah.
Another
So
2-3 minutes, I'm fine.
yeah. Let's go for another 2-3 minutes. So
3 minutes. Okay, great.
I would say for people, I know we have the questions here. Whoever may, putting in the chat, even in YouTube, we'll take it, and if at all needed, we'll arrange on one more session. No worries. If Dr.
I'm glad to come back. This is such a nice opportunity to connect with our community. This is more important to me than all the heart patients I'm dealing with. Because by then they're already sick. We are putting out fires. If we can avoid the fire, it is 100 times better.
That's the gratefulness. That's the gratitude. Yeah, definitely. So don't worry. That's what I'm saying. So anybody who's is missing the opportunity to answer the answers from doctor, we'll try to arrange another session with more holistic. We are trying to do them more often, I would say, right? So because the awareness is something that we need to be having it. That's the bottom line, right? Our ancient Siddha practices is all about prevention than the cure. So we'll definitely take it anyway. So we'll have another 2-3 minutes or 2-3 questions, and then we'll wrap up for today. But definitely we'll meet again.
Sure. There's maybe 2 questions I can take. One is about kids and one about women. So I'll ask those. Is fasting recommendation for kids under 18 as well, or only for adults?
Excellent question. Yeah, above 18 is fine. Actually, there are several traditional systems where even children who understand what fasting is, they can do it. So anybody above the age of roughly 10, 12, they can do a little bit. Once or twice a month is not going to hurt them at all. There are so many biological benefits. So above the age of 18, I would suggest everybody learn it right and do it right.
Okay, great. And the next question is, after menopause, we see that women are prone to heart disease. What do you advise women after menopause to stay heart healthy?
Everything we recommended for men, women also have to practice.
Okay, great.
We can take another 5 more minutes questions. If everybody is willing, I'm happy to spend 5 more minutes.
Sure, sir. So we have another question from Bala from Texas. What are the regular tests needs to be done after first episode of heart attack?
After a heart attack, we have to do the angiogram, do a balloon, stent, surgery, whatever. After that, some private practices every year they do a stress test. But if you're not having chest pain, if the heart squeeze is good and you're able to go through life, in our practice at the university, we don't recommend serial stress testing. Cholesterol, we check every year. And blood pressure, every visit, we make sure it is okay. Diabetes, we control. And aspirin, Plavix, whatever is needed to keep the stent working, we continue.
Okay. So for those with the stent, can they do meditation? Was a question from Edil, but I think you answered that already. Your patient.
Those without the stent should do it. Those with the stent should do it. We should do it from the earliest stage in our life that is possible. Telling our children is difficult. So when we are happy and when the children realize my parent is doing better internally, then they will themselves hopefully be inspired to live better. So when we advise, they don't want to take it, but they are willing to open their heart to us, our way of life.
Yeah, maybe one more question, Dr.
The questions are too good, so I'm not going to go. I'm going to stay here.
Thank you.
So if you have time, I'm happy to answer a few more minutes.
Yeah, our Marbukulil president, in fact, Raj is here. He's asking a question for his friend. He had a stent placed in 2021. He works out 5 days cardio, but recently has discomfort even with simple treadmill, on medication for cholesterol and high BP. Is it possible to get buildups where stent is placed?
Yes.
How this can
So if the pain is coming back, that means you need to talk to your doctor, maybe get a stress test or a repeat angiogram to be absolutely sure what is happening before we plan further. I'm glad he's exercising, doing everything right. But despite everything we know, we don't control all the factors. We say coronary artery disease is multifactorial. That means we don't know the exact reason a lot of times. So best thing is to have it evaluated. This person is very lucky to have chest pain. Because heart problems without chest pain means they don't know what's happening. When you have chest pain, you can go to the doctor, have it followed up. Okay.
All right. Thank you. Thank you, doctor. And there's a question on coconut milk. Is it considered bad for heart?
Coconut is changed back and forth, but coconut, tender coconut water is very good. Coconut milk is okay. And even the actual coconut, they say the MCT or triglycerides and all of that may be actually healthy, especially when we are trying to fast, it may go into ketosis faster. So doctors are learning these things, but if your tradition requires, your taste requires, you're fine. As long as you limit the quantity, you're okay.
Yeah.
All forms of coconut.
Yeah.
Coconut
Couple of
oil.
people, sorry, doctor. A couple of people are interested to know, how do we realize that we are under stress? Is there any trigger to look out for?
The person who asked if they want to show their face, that's great. The reason is the world believes everybody is under stress. If they don't even know they are under stress, very likely they are not under stress.
They're not under stress.
You are blessed.
Maybe that's a Siddha, practice question also. That's probably, would you like to say something or?
The thing is, the stress, normally we used to feel kind of sensation at the lower abdomen. Okay. If you hold that for a few seconds, whatever you are about to say or you're about to react or respond or anything, that will go away. Okay. If that that comes only for a few seconds, not even a few seconds, 2 or 3 seconds maximum. If you feel that sensation at the lower abdomen, that's you are under stress. You are about to break out, that kind of thing.
Thank you. Yeah. There's one more question. Questions are really, coming so quickly back to back.
Before I go on to the next question, this concern about stress, there is actual stress when there is an earthquake or a war or a famine or a drought, or if we've lost a dear family member, that is actual quantifiable stress. But there's also a thing called perceived or subjective stress. So I may be stressed because I'm worried about winter weather. But winter is going to be there for 3 months. That's a stress that I'm putting on myself, right? Winter is going to come every year. So that is perceived stress. So we can control a lot of that stress. And even the physical, actual stress, if we learn self-inquiry and mindfulness, it becomes so much easier to cope with it. So you learn the meditation. Just because we said you don't have stress doesn't mean that you don't need to address some subtle levels of it that may be there. All human beings, by and large, have some level of stress. There is some studies saying maybe about 2 to 5% of society may have less stress than closer to zero stress. But I haven't met any patient in the last 20 years who said, "Doc, I don't have any stress." I haven't met anybody like that.
Yeah.
Thank you. So Bill probably will take that to last YouTube question.
Okay. I have one last question. Probably I'll just ask that one from Jay. Will low heartbeat in the range of low 50s and sometimes 48 or 49 lead to any problem? My understanding is due to the possible sinus node issue.
Yes. Sinus node means that's where the electricity starts. And some people have like that throughout life, and it doesn't mean anything sometimes. But if it happens suddenly in the third adulthood, that could mean that the conduction system is slowing down. This is an electrical problem. This is not a blood supply problem. Heart attack means blood supply problem. So these electrical problems can rarely cause fainting or fall and things like that, but it's not life-threatening. So a lot of times you can monitor it, and if it makes you dizzy, putting a pacemaker will take care of it. This is a much different thing compared to heart attack or a coronary artery disease that we've been talking so far about. Low heart rate itself doesn't mean, no, you're going to have a short leg. No, it may actually be okay. If it's not bothering you, it might be fine. ECG is definitely needed to understand why it is low. Athletes have low heart rate too. So that exercise training makes the heart rate go down. Just like yogis also will have lower heart rate because they are so relaxed. They don't need the heart to beat 80 times. Just 40 times, they are fine.
True. Thanks a lot, doctor. Thanks for your patience and answering all these questions.
Vail, can I ask one more question to the doctor? I think
Sure.
that may be important because right now the culture is everybody's moving towards, I want to do a marathon. After 40, I have to sign up for a marathon. How do you look at that culture? Because people are signing up for a marathon because everybody else does it. And that seems that it's being a trend. And I feel like it's not good. So I just want to get your opinion.
This is such an important thing. People suddenly wake up to, I want to become healthy. It is not a good sign. If people have been exercising throughout life, their body is more fit and able to do it. So gradually building up is good. But thinking we are running a marathon or even training, say from 2022 to 2024, and finally in 2025, 3 years later, if I run a marathon, even that may not make me healthier. That is the message that I want to give you. Half an hour of brisk walking or some running, all that is fine. But these type of extreme exercises may not be making anybody live longer. So don't do it because you might improve your health. That's not needed.
Great.
We are stressing the heart. A significant portion of these people are actually hurting their heart health. Boston Marathon, that study was done. Many people run at Boston and people get into trouble.
Yeah.
Okay, so thank you, Doctor. Thanks for everybody for your patience. In fact, we have a vote of thanks coming up. But in the meantime, I want to highlight few of one of our volunteers, Selva, is not here. He's Marabukudil's secretary. And I want to introduce some of the people who are really volunteering at the front end. Raj Prabhu Marimuthu is our Marabukudil president. Velraj is our one of the directors. Lakshmi Velraj is our treasurer. RK is our vice president. And Ravi Shankar is the India coordinator. Is leading the India, or basically is taking care of all the time zone related things, because we are all in the Western time zone and he's taking care of the Eastern time zones. He's taking care of all the Australia, Maldives, Middle Eastern queries and everything. So I'll share the link in the chat. In case all the invitations will have all the information, but still the WhatsApp link you can join. And anything, it's not necessary that you need to do one practices or one process, but there are hundreds of thousands of millions of practices from Siddha. Okay, all we need is you take care of yourself, your family, your kids, your surroundings, your family, friends, colleague, everything. Everything is supposed to be balanced, right? So that's what we are all trying to come together. Everybody is expert in one area, and we are all trying to come together in a common ground and say, hey, how do we do it better, right? So with that, I really would like to thank Dr. Anand in this case, because when we started this conversation, he's busy with a lot of appointments, and he's busy until January, right? So he has been going on with a lot of the meetings and all those things, right? So we got a slot at this point of time, so we have made it. And definitely this is not going to be the one and final, but this is going to be a starting. Okay, so we are going to have much more interactive sessions like this in the coming weeks, coming months. Definitely we have more expertise here from Siddha, holistic and meditative. So many things coming, so many things available. Our intention is to bring into the table for you to choose that option, right? But be healthy. The bottom line is be healthy. So Marabukudil is offering no cost meditative Siddha practices. So the Marabukudil's objective is to reach out to the real Siddha, meaning that the Samadhi state, right? So yeah, thank you, Doctor. Thank you all the volunteers, all the participants in the YouTube and Zoom link and everybody. So back to you, Vail and RK.
Yeah. I would like now call upon RK to say a few words on vote of thanks. He is our Vice President in Marabukudil. RK, over to you.
Thank you, Vail. Good afternoon, good evening, good night. Thank you is such a prayer that cannot be seen or touched. It must be felt by heart. I feel honored and privileged to get this opportunity to propose a vote of thanks on this special occasion, especially during the week of Thanksgiving. It's really nice. On behalf of Marabukudil, I would like to thank our chief guest, Dr. Anand, and our Honorable Dr. Siddha Yogi Rajababaya with their presence today. Today's session has been very informative and how to prevent and reverse cardiovascular disease. We hope this session will be helpful for everyone to change their lifestyle as well as understand their inner self. This session, and if you are interested in more such topics, please send an email to siddhaspiritualscience@gmail.com. I'll put a message in the chat room and Zoom. Also, I would like to thank our Marabukudal Foundation, Board of Directors and officers for their constant support and help. Also, I would like to thank people at High Life Journey, their Board of Directors, officers, and many more people who are here to be part of this wonderful journey. With that being said, again, thanks for joining. Have a nice day. Nandri.
Thanks so much for this amazing opportunity. Thanks, everyone.
Thanks to
Have
you.
a wonderful day. Happy Thanksgiving.
Thank you all.
And I'm happy to come anytime, whenever.
Thank you. I mean, it's your pleasure. It's our pleasure to have
my
you here.
privilege.
Thank you, doctor.
Thank you. Thank you. Thank you all.
Thank you.
Thank you.
Thank you so much.
Thank you, doctor, so much. It was very valuable.
Doctor, thank you, Aya. Thank you,
I think it's a wake-up call for many of us.
Yes.
Thank you, Aya. Thank you, doctor.
Thank you.
Thank you, doctor.
Thank you,
Thank you.
doctor. Thanks, Siddha.
Thank you.